Over the past week, we've seen 3,352 people diagnosed with COVID-19 in our country. To date, 17,280 people have now been diagnosed as COVID-19 positive in Australia. Over the past 24 hours, 397 of the new cases were in Victoria. 17 new cases have been reported in New South Wales. 3 of these are overseas acquired, and those people are in hotel quarantine, and 14 cases were locally acquired. We've seen 1 case in the Northern Territory, which was locally acquired and related to interstate travel, and we've seen 2 cases reported in Western Australia, which we understand are recovered cases involving people who were infected with COVID-19 in the past. Sadly, we have passed another milestone today with the announcement that we have had 200 deaths reported in Australia, with 4 new deaths reported in the past 24 hours. Every death from COVID-19 is a tragedy, and these are real people, not statistics. The first death in Australia from COVID-19 was exactly 5 months ago, on March the 1st, with the death of Mr. James Kwan, aged 78, from Perth. Mr. Kwan had been a passenger on the Diamond Princess cruise ship. On May the 19th, Mrs. Alice Bacon, aged 93 and a resident at Newmarch House, was the 100th person to die from COVID-19 in Australia. And today we report that 200 people have died in our country. Our thoughts are with those who have lost their lives to COVID-19 and with their family members and friends who grieve their loss. The people who've died in the past 24 hours were aged in their 50s, 80s and 90s. Nationwide, there are now 399 people with COVID-19 in hospital, which is an additional 33 people hospitalised since yesterday, and this includes many people who have been moved from residential aged care facilities in Victoria. Among the people in hospital, there are now 50 people in intensive care units, which is 6 more than yesterday, and there are 28 people reported to be on ventilators, which is 1 more than yesterday. Thank you to all our healthcare teams, especially in Victoria, who are providing excellent care to those people who are in hospital and especially to those who are seriously unwell. Over 4.3 million COVID-19 tests have now been carried out in Australia, and over 63,000 tests were carried out yesterday. New South Wales Health today has reported that the COVID Safe app has assisted in the identification of an additional 544 people who attended the Mounties Club in the Western Sydney suburb of Mount Pritchard around the same time as a person who had the app downloaded on his phone. This includes at least 2 additional people who have now been confirmed as having COVID-19. This identification of these contacts and the identification of people who are infected with COVID-19 could literally have prevented a spread of serious outbreaks of cases, as we are seeing at the moment in Victoria. This is a timely reminder of the importance of the COVID Safe app in assisting in the tracing and the identifying of the contacts of people who have been diagnosed with COVID-19, as well as identifying the people you do know, the people who share your home and your workplace. The COVID Safe app can also identify people you do not know, people who may have been sitting at a nearby table when you were in a cafe or a restaurant, people who may have been standing or sitting beside you on an aircraft, on a train, on a bus or a tram, people who may have been standing in a queue in front or behind you in the supermarket. If you haven't yet done so, please join with the 6.8 million Australians who have downloaded the COVID Safe app. And please make sure, if you have the app on your phone, that it is running on your phone, and please take your mobile phone with you every time you leave your home. The COVID Safe app is part of the armamentarium which is being used to protect us all. It may assist in alerting you if you have been exposed to someone with COVID-19, and in doing so will protect the health of those you love.